The term Canadian dream isn't as common as the American counterpart. It is said that money doesn't buy happiness, but struggling to make ends meet makes it a lot harder to be happy in the first place. Economics is a big part of people's lives, and today more and more obstacles appear to be in the way of average Canadians reaching their goals and dreams. And buying a lottery ticket is not a retirement plan. Interest rates, food prices, issues with healthcare, all affect the lives, literally, of every Canadian. Recent changes to all of these have created a perfect storm of financial pain, especially on those who feel it most. Inflation and food prices. Canada's inflation rate in August was 3.3%, up from 2.8% and higher than the previous month. While this is a far cry from the 7% of 1 year ago, it's still hitting average Canadians hard. Salaries haven't entirely kept up. The consulting firm Eckler Limited projected a 4.2% average private company salary increase, excluding 1% under wage freezes, in 2023. This is roughly the same increase as the year before. However, the report also mentions the increases for 2022 were lower than their prior projections. British Columbia, Ontario, and Quebec projected the highest average salary increases, with PEI and the territories at the bottom. However, government employees are far more likely to be experiencing wage freezes. Also, pensioners and those on government subsidies haven't fared much better. Ontario's Conservative government made a surprise about face and gave disabled people receiving ODSP a 5% increase. Not every Canadian was as lucky. The federal Liberals and the Senate have passed a bill calling for the creation of a national disability support program. Details, however, are sparse and vague. Food price hikes have been even higher. In 2022, food prices rose more than any year in decades. Yet back in December, Canada Food Price Report predicts they will rise 5 to 7% in 2023. The report blamed the recent pandemic, Russia's illegal invasion of Ukraine, and a weaker Canadian dollar. Not mentioned is that Canadian grocery chains continue to see rising sales and profits. The federal Liberal government's grocery bailout amounted to about a week's worth of groceries for most Canadians. Some government programs have been increased to try to combat the problem, but the food banks continue to experience so much pressure that some have taken up advertising for donations. In January, Second Harvest, Canada's largest food rescue organization, projected a 60% increase in food bank dependency over the year before. More starkly, 2022 had already seen a 134% increase. A press release by Lori Nickel, CEO of Second Harvest, says, "Access to food is a human right, not a privilege. More charitable food programs will not decrease food insecurity in Canada. More food charity is only treating the problem, not finding a solution. In the long term, individuals need government support, like income regulation that's indexed to inflation, and solutions for affordable housing so that nonprofit food programs are not needed in the first place." Gasoline prices continue to rise, with the war in Ukraine being given the blame by most. Interest rates, house and rent prices, housing shortage. Simply having a roof over one's head is becoming a struggle for more and more Canadians. The average price of a Canadian house in July was $668,754. The annual pre-tax income of Canadian households so far this year is close to $75,000. These numbers vary widely by province and by city. For example, to live comfortably in Toronto is projected to require a full-time wage of over $22 per hour. Vancouver is not much better at $20.50. The Canada Mortgage and Housing Corporation, a Crown corporation, was created to create housing affordability for all. Their projections are gloomy. House prices are expected to fall in 2023, but not to pre-pandemic levels. New housing starts are projected to grow through 2025. It's predicted to be a temporary drop, with prices rebounding and rising into 2025. The rental market becomes increasingly competitive as fewer options are available. They also say affordability challenges in the home ownership market continue to drive up demand for rental units. This will push up rent, making them more unaffordable. Canada's most expensive markets, Vancouver and Toronto, will be impacted the most by soaring rents and limited housing supply. In Toronto, some rental applicants are offering more than the asking price for rent just to ensure they get the place at all. Economic recovery and immigration will add to the demand for housing in 2024 and 2025, and the lack of affordable options and new supply will continue to create challenges. On September 6th, the Bank of Canada kept interest rates the same, at 5%. They are also continuing a practice known as quantitative tightening. What does that mean? Quantitative tightening is when a central bank sells its accumulated assets, mostly bonds, in order to reduce the supply of money circulating in the economy. As reported by Bloomberg, Canadian officials said the economy has slowed significantly. They report marked weakening in consumption growth, a slower housing market, and the overlooked impact of wildfires across huge swaths of the country. They noted the labor market is easing gradually, but wage growth remains high. Some economists are warning of a possible recession. The idea of things getting even worse is chilling. Healthcare. When Tommy Douglas envisioned the future and the government's social healthcare programs he worked so hard to make a reality, he must have hoped for better than this. Canadian healthcare is struggling. Unions blame governments, governments blame unions, despite some premiers still cutting medical funding. Canada.ca lists links to projects every province and territory are currently doing to improve healthcare wait times. Control of healthcare is, after all, entirely within the domain of the provinces. Clearly, politicians across the spectrum recognize healthcare as a major issue to patients and families across the country, but yet very little has been done to improve the system, and change is happening at snail's pace. In December 2022, a 37-year-old Nova Scotia woman died at hospital after a lengthy wait to get adequate treatment. According to the woman's family, after being triaged by hospital staff, she waited more than 6 hours in the emergency room before being provided a room in the unit, and another hour before seeing a doctor and receiving pain treatment. Just a day before, a 67-year-old woman had died at home after waiting more than 7 hours at a Cape Breton hospital emergency room, and still not being able to see a doctor. She'd given up on waiting and decided to go back home. In summer 2022, the Saskatchewan Union of Nurses reported 83% of its members had vacant positions. Back in 2021, PEI had 20,000 people without a doctor or a nurse practitioner. Now it's more than 28,500. That's 1 in 6 Islanders. Healthcare was a prominent issue in the recent provincial election. According to the Canadian Medical Association Journal, healthcare in Nunavut relies almost entirely on short-term workers, mostly from outside the territory. Retention of those workers is very low. A March 2022 poll of BC Hospital Employees Union members found a third of them wanted to quit their job in the next 2 years. Understaffing is leading to increasing burnouts, leading to increased understaffing. It's a vicious cycle and there's no end in sight. In Quebec, Health Minister Christian Dubé is racing to pass Bill 15, which intends to establish an agency to be known as Santé Québec. Touted as making the health and social services system more efficient, the new Quebec agency would become the sole employer of healthcare workers in the province, whereas now there are 34. Rather than having 136 collective agreements, there would now be 4. As first reported by City News, Dr. Paul Saba, a family physician and health advocate, raised concerns. In the past, we had local council of physicians for each hospital, and now that's disappeared. We used to have local boards for each hospital and each healthcare center. Those have disappeared. Again, governments blame unions and unions blame governments. There are thousands of ideas and theories on how to improve things. Meanwhile, nothing ever seems to get better. So, is the Canadian dream in trouble? Back in 2001, Canadian social researcher Michael Adams published a book entitled Better Happy Than Rich, which examined attitudes toward finances and happiness in Canada and the USA. Canadians were found to be more interested in happiness than wealth, compared to our southern neighbors. If this is still true, Canadians may feel a bit better about their situation, even if that situation is dire. Does that mean Canadians should roll over and accept their fate? No. Change, however, requires effort. Effort that is in short supply when one is struggling against poverty. In the end, people must make their opinions heard, with their vote, voice, and even their wallets. If not, it's not simply that nothing's going to change, it's that things will only get worse. And that's just the half of it. If you enjoyed this video, please give it a thumbs up and leave your thoughts in the comments section below. Don't forget to subscribe.